CancerPal is a powerful tumor growth kinetics application that runs on an iPod, iPad, or iPhone. It's a unique piece of software that internally constructs exponential growth curves that define specific tumor growth and tumor marker expansion over time. This software, for the first time, allows the clinician to be able to predict how large a tumor or its marker would be at any selected time in the future if it were allowed to grow independent of any therapy. The CancerPal algorithm calculates the projected tumor size, which is invaluable in determining an objective numerical value that measures the efficacy of a therapy in suppressing or accelerating tumor growth. The specific kinetic parameters analyzed by this application include the following: tumor-specific growth rate, tumor marker growth rate, tumor and marker-specific acceleration and deceleration, tumor volume and marker doubling times, projected tumor and marker size at any future date, a continuous numerical value defining adequacy of treatment response, tumor volume calculations, approximate time since tumor inception, and finally, the approximate time for tumor to reach a mass of 1,000 cc's, a mass considered to be incompatible with life. The app's novel ability to rapidly identify tumor and marker acceleration identifies whether therapies are accelerating or decelerating tumor growth, and if a tumor is undergoing a mutation capable on its own of driving tumor expansion at an accelerated rate. In addition to the patient's name, CancerPal only requires input of either 3 tumor or tumor marker measurements: one made at the time of diagnosis, one just prior to the start of therapy, and the third at the time the efficacy of therapy is evaluated. Here, CancerPal's output parameters are noted in red. Generally, the oncologist first evaluates a patient after the appearance of an index tumor. Here we note a patient who presents with a 1 centimeter tumor and a slightly elevated CEA titer of 5.2 nanograms per mil. The patient is sent for imaging studies to complete the staging process. It is now usual to ask the pathologist to send a tumor biopsy specimen for several immunohistological studies and therapy-directing gene mutation analysis. It's usual during this interval to observe that the tumor and its marker have both slightly increased in magnitude, as indicated in our video. Importantly, it is this progression of tumor before the initiation of therapy that CancerPal uses to analyze tumor-specific growth kinetics. It is this information that the software uses to internally model the exponential growth of both the tumor size and tumor marker values. As an aside, our video displays a characteristic exponential curve. The slope, as a function of time, rapidly changes. In spite of the attention given to Gompertzian tumor growth, the literature continues to verify that during the time of clinical observation and patient therapy, tumor growth displays exponential rather than Gompertzian kinetics, and CancerPal uses this relationship for its calculations and predictions. Classically, a patient is treated for several weeks before post-therapy tumor size and response is evaluated. Residual tumor size is then compared to the pre-therapy baseline value. As noted by the post-therapy smaller yellow tumor, a decrease in tumor diameter or marker for the tumor when compared to the pre-therapy value would be scored as a good response. However, as indicated by the larger post-therapy blue tumor, as compared to the smaller pre-therapy tumor, we demonstrate what has always been termed treatment failure. But not so fast. CancerPal calculates the projected tumor size or projected tumor volume. The projected tumor size is the size the tumor would have reached had it been allowed to grow in the absence of any therapy. Some tumors that grow during therapy may have actually responded well to therapy by virtue of potent growth inhibition. To uncover this phenomenon, it's essential to compare post-therapy tumor size not to pre-therapy, but rather to the projected tumor size. Again, the size the tumor would have been had no therapy been applied. In the case where tumor displays slight growth, the CancerPal app is capable of objectively measuring tumor inhibition if present by comparing the post-therapy tumor size, here the blue tumor, to the CancerPal projected tumor size, as calculated by CancerPal, the pink circle. This comparison, which is not routinely made in the clinic, often reveals evidence of occult, potent, drug-related tumor inhibition, the magnitude of which would surprise both the physician and the patient. Illustrated in the video by comparing the blue circle to the pink circle. If the CancerPal algorithm reveals potent tumor growth suppression in the face of a slight increase in tumor size, we would recommend, rather than completely discarding the treatment drug, a more prudent course would be to continue the therapy while adding an alternate drug with different toxicity and a different and possibly synergistic mechanism of action. In a recent study, altuzumab alone induced unimpressive stable disease in advanced resistant myeloma. However, when adding decadron and lenalidomide, an impressive 80% response rate was observed. The larger green circle, which has just appeared, represents tumor acceleration. Here we define accelerated tumor growth as growth that exceeds the CancerPal projected tumor size. As you recall, the projected tumor size assumes that the tumor is following its projected exponential growth curve, which would occur in the absence of any therapy. Occasionally, the treating physician is impressed that the treatment is associated with acceleration of tumor growth, or that a tumor may have developed a growth accelerating mutation. Without knowledge of CancerPal's exact projected tumor size calculation, this observation would be based on an inexact impression. We would have no objective way to confirm this observation. Now, however, CancerPal calculates an exact numerical value for the degree of tumor acceleration or deceleration. Tumor deceleration, or the rate of tumor shrink, or the deceleration of a tumor-specific marker, has recently been used by some as an early indicator of the ultimate impact a drug would have on survival. By calculating the projected tumor size at any future date, CancerPal allows the easy identification of a subtle change of the intrinsic pre-therapy rate of tumor growth. Should we routinely compare the post-treatment tumor size to the CancerPal projected tumor size as part of drug activity or drug response evaluation? Is it reasonable, as we suggest, to continue drugs that suppress tumor growth when compared to projected tumor size, even if the drug allows slight tumor growth when compared to the pre-treatment tumor size? As oncologists, we may routinely overlook potentially important therapy-related changes in tumor acceleration and deceleration. If we suspect tumor acceleration in the clinic, we rarely have the facility to measure this. CancerPal resolves this issue by rapidly calculating a numerical value for tumor acceleration or deceleration when this is present. Observation of tumor acceleration in the face of therapy may lead to research that leads to a better understanding of drug and tumor biology.